Alright, you guys, so day 2 of staying at the hospital. I will probably be here a couple more days until a therapy, like in-stay therapy, opens up for me. They started that process yesterday. My throat is raspy because my throat hurts from where they had the tube. But yeah, I was supposed to go home originally. That didn't happen, especially with it being late, and I was supposed to go home today, but didn't work out. So because I can't go really far on my hip, like my surgeon told me. So let me explain. I got my surgery done at noon yesterday, and I was out at 4 o'clock yesterday. It is now, that was Wednesday, today's Thursday, and it's 8:25 p.m. So it's been like 28 hours. And I still can't really move. I think I sprained my foot when I got up the first time last night. But because of how bad my hip was when they had to replace it, and just do the things that they had to do, it's anterior in the front, side anterior, and posterior is what we're calling it. So I'm on all the restrictions. So I'm going to be staying here until insurance approves for me to be transported, which Daniel could take me, but transported to a therapy center where I will be staying there. Originally they said 6 weeks, and then on top of like the extra bed rest and things that I need to do. But hopefully, because of my age, my CMT plays a big part of it too, with my healing, so I don't heal really fast. But yeah, hopefully I don't stay there longer than 10 days. But yeah, they're gonna work with me at first, because I literally can barely move. Yeah, so they're gonna work with me, and then work up to 3 hours of physical therapy every day. That's a lot. I can only do like an hour of physical therapy when I was younger, so doing 3 hours post-surgery, I'm gonna have to be my advocate and be like, I can't do this. This is like, I could do what I can, but that's about it. I'll have nurses around me 24/7, as if I am in the hospital right now. And my incision they said that it looks great. I have this device that's going into, I want to say my stomach. I think it's going in like right at my groin area, but like my stomach down into the site to help with any drainage and things like that. So I have to have that on me at all times. I skipped medication today, not realizing that I did that, and then at, I think it was 5:30, 6 o'clock, I asked if I could have some pain meds, and the nurse was like, you actually haven't had any since this morning. So I got pain meds, and then I fell asleep. I felt good, and I just got some more. So I'm chilling, I'm relaxing. I don't know how long I'm going to be here, but I know that the kids are situated. Daniel's got them, my mom's got them. I'm blessed to say that I have an army behind us that can help with the kids. So, grateful. I'm ready to go home. All in all, that's that. I was able to sit in the chair twice today, and it was pretty comfy. Still hurts to get out of bed, still hurts to like lean forward. Well, I say lean forward, like kind of like push yourself forward to get out of the chair or to get up. I was able to go to the bathroom, not by myself, but to the actual bathroom today, and I'm not doing that again. I feel like, I know it's not low, but from where my injury is and the toilet seat has to be lifted, it just hurt. It hurt trying to sit there and trying to get up, and now I put a lot of strain on my hip, and I'm trying not to slip, and I had a nurse there to help me, but it hurts a lot. So the bedside toilet is what I'm going to be using, because it's more my height, more my ability to go until I get better, until hopefully physical therapy has a lifted toilet seat that I can sit on that helps me. So I'm in limbo land. My face itches, but it's fine. Alright, I'll see you guys next time. I wanted to give you an update. Oh, real quick. So here's a funny story. I am lactose tolerant, but it's not all dairy stuff. It's more of a certain protein. So like the protein in milk, I can't have it. Protein in like certain cheeses, I can't have it. It's a dairy protein. So the more it is in certain products, I can't eat it. But I know what I can't eat. So that's what they put on it, and they just said not to give me milk in a cup, right? When I get my food. Well, every time I go to order something downstairs, they're like, no, you can't have this, you can't have that, you can't have this, you can't have that. And I mean, it was like the simplest little things. It was like, because I gotta boost my protein because my iron levels are low. So I asked for a steak taco, even without the cheese. They said I couldn't have it. I asked for something yesterday morning for breakfast, and it wasn't even nothing dairy related, and they said I couldn't have it. So I had strawberries, and I didn't even eat the applesauce. So tonight, right before Daniel left, I asked him if he could order me some spaghetti and meatballs without the cheese because I didn't want to hear them complain. And they told Daniel that I couldn't have the spaghetti meatballs because the dairy in the meatballs. But there was no dairy in the meatballs. So they were like, we can give you the noodles with the marinara sauce on it, but no meatballs. And he was like, whatever. And I was like, yeah, whatever. I gotta eat something. So we got that with some melons. They bring it up, and they gave me spaghetti with spaghetti sauce, 4 meatballs in a container, marinara sauce in a container, and then my melons. And it's like, why couldn't y'all just put the meatballs on top like you originally would have? I'm not allergic to meatballs. So they're going to get that figured out. My nurses tonight is Amber and Bailey. So that's fun and exciting. My grandma wants to come down and see me, but her car's not working. The kids couldn't come in and see me because they're under the age of 14 and it's cold and flu season. Understandable, so I've had to like video chat them. Trying to keep everybody in the loop, trying to keep everybody updated, trying. And yeah, so here in a half hour I get another dosage of my oxycodone. I'll tell you what, I am not one for pills. If I have to take one, I'll take like half of a Tylenol. Like 100, I think it was like 150 milligram Tylenol, and I cut it in half, and that's what I take. But I'm telling you what, the oxycodone for my surgery was definitely needed because it hurts so bad. So bad. So what I'm going to do is I'm going to hop off here. I might turn these lights off, get some sleep. Don't forget to like, subscribe, comment. And for everybody that is commenting, I will get back to you as soon as I can. I can do verbal updates right now because of how loopy I am. But like sitting there and typing back, I'm like, ugh. I'll reply back to you guys as soon as I can. I will have my phone when I go to physical therapy. I'll have my toiletries and things like that. So it's just, it is what it is. They're gonna try to get me a private room. So then that way, like, Daniel comes up, possibly the kids could come over and visit too. And kids got me all kinds of stuff. We went home. They got me like some plushie animals. They got me a heated sweater thing that I wanted to keep here, but I didn't want another thing to pack along with me. And they got me a weighted pillow that I could sit on. They got me all kinds of stuff, and I'm greatly appreciated with my mom. But yeah, I'll see you guys next time. And if I have an update on, I should. Aubrey has her ENT allergy appointment tomorrow. Daniel's taking her, so I'll know some type of update. I might have to be on the phone, like, communicating what's going on, even though I know Daniel can, but with everything going on, it's just easier to have a backup to express things. So I am just chilling. I'm relaxing. I have chapstick that the hospital gave in a bag. Hold on, you guys. I'm not allowed to bend that left side. But I got chapstick, and you know what? I actually like this chapstick. I don't know if it's medicated or what. It's mint lip balm, SPF 15 sunscreen. Sorry, y'all can see. I was reading it. But yeah, I've been putting it on my lips. I had just a couple of days ago, I had a cold sore that's went away. So it's not contagious. It's just hanging out. And my lips have been chapped since surgery. So, well, before surgery, but mostly after surgery. So I'm going to drink my Sprite to help my throat. And I gotta do my breathing treatments. I'll show you how to do my breathing treatments. And I have to do this every hour. I think it's 10 of them at a time after surgery. So let me grab it. Okay, so you guys are gonna see my head. The highest I get it to was 150. I'm supposed to hold this like straight out and sit all the way up, but it's kind of possible to do right now. So I just take the collar straight. I have to breathe in and then breathe out, and then I have to cough after 10 just to keep my lungs working and not get a blood clot and things like that. So that's how I do it. See, I don't know. You gotta keep this little bead between these two little blue lines. It was given that my lungs would get worse after surgery, so it's trying to keep them going. I can't get to or past 115. But I'll get there. That's all I can do for right now. I had to work my way up. But yeah, so I'll be going to like a nursing home type of setting, but it's not exactly a nursing home. It will be like assisted living with physical therapy and nurses on call for me like I am here. Yeah, it's great. I did, however, walk from right here by my bed was the chair. And I'll tell you what, it hurt getting up. But I walked from the chair to right outside the door, and I came back in and I was done. I was like, can I sit down? Because when I'm laying down, like I am now, my pain is about, depending on how long ago I had painkillers, it will vary from like a 2, 3 to like a 7. And then as soon as I get up and I have to move the leg or walk or anything, it's like a 9 to 10 in pain. So it's excruciating. But it's 8:38 at night. I just want to give you guys an update, and I'll give you updates as much as I possibly can, as long as I'm not like looped out. So hopefully insurance covers, because there's absolutely no way I can go home and finagle and try to figure out like my blood pressure dropping if it does, my sugar dropping if it does. I cannot, even with assistance, I cannot get to the toilet by myself. It's hard. Yeah, so I think the physical therapy part will be good, but it's gonna start out slow because I can't do it. Anyways, so I'll see you guys tomorrow, I guess. But I'll give you guys an update on Obs's thing. We don't know if she has allergies. We don't know if she has asthma. We don't know if it's an autoimmune disease that's going on. There's just so many things that we don't know, and like we speculate, but we don't know. We don't know if it's something to do with her heart murmur, but she's got an appointment for the ENT tomorrow. Daniel's taking her, so it's greatly appreciated. And I'm just gonna hang out here. Alright, I'll see you guys next time. Bye, guys.